Hi, welcome to SPED 101 with Dr. Judith. The purpose of the mini pods is to build awareness so that we could be able to help our loved ones with disabilities to be successful in school and in life. And I have been an educator for over 30 years, and I have been a school psychologist for the last 20 years. So I'm going to be talking about it from a school psychologist perspective. I hope you find this mini pod helpful. Today's question for the mini pod is, what's special education, or the acronym is SPED? So a student is able to receive special education services if they qualify or if they have a disability. So they are going to have what is called an individualized education program, an IEP, and in the IEP is going to state their strengths and their needs and goals. And so the services that they're going to be receiving from special education are indicated in the IEP. So there's different types of settings where students could receive the special education services, and it goes from least restrictive to most restricted. So here in the least restrictive is the general education, where most students don't have disabilities. Maybe anywhere between 5% and 20% of the students in the school may have a disability. So that's the general education classroom, where the teacher from special education may go inside the classroom, the general education classroom, and support the student or students with special education needs. And or it could be that special education, and this is called the resource specialist program support. So they get support from a teacher from special education in the classroom. This one is the special education classroom. So that one would be where they are in a general school, but then there's a separate classroom where only students with disabilities attend and they get support. And it has less students and more teachers, so they get more individualized attention and more support. And it could be one class during the day, like if it's a high school, or it could be 2 periods, out of their 7 periods, depending on the student's needs. Another level that is more restrictive is a special school. So in that school, it's only for students that have disabilities and special needs, not for general education students. After that, we have the homebound, so students with disabilities that are more severe and they are not able to attend the school, so then they receive their instruction from special education in their home. And the last level, which is the most restrictive one, is the hospital or residential setting. That's where they receive their special education instruction, because, and that one is at 24 hours a week, 7 days, 24 hours a day, 7 days a week, where they live there, and they also get their instruction there. So I'm going to talk a little bit more about the general education setting. Those are the regular schools that most students attend. And students with disabilities, there are 13 different eligibilities for which they may qualify, or different types of disabilities. The 3 that are the most, or 4 that are the most common, are a specific learning disability, which is when a student's general cognitive ability is within the average range compared to their peers. So the way they learn information is in the average range compared to their general education peers, the way that they learn. And then for some reason, they are going to be significantly below average in reading, writing, or math. So their skills are going to be at least a couple of grade levels below their grade, and it could be due to some type of processing disorder. It could be due to that they have significant challenges with paying attention and sustaining attention, the way they process the information visually, or the way that they auditorily, the way they process information, maybe with memory. So due to something that impedes their learning, they are going to be significantly below average, but it's not due to their cognition or the way they learn. So that's a learning disability, a specific learning disability. Another common eligibility for students in a general education or in a public school would be other health impairment, and one of the it could be due to attention deficit hyperactivity disorder, so having a diagnosis or symptoms of ADHD. And then another one would be autism, if a student has a diagnosis of autism. Or it could be also emotional disturbance if they have anxiety or depression that significantly impedes their academic learning. So those are the different disabilities. And in the next mini pod, there's another mini pod where I address what are the different disabilities, the 13 disabilities more specifically, and then also how to get a student evaluated to see if they qualify for special education services. So please, if you have any questions, be sure to write them down and I will try to answer them. I hope you found this mini pod helpful. Thank you. My passion for education started in 7th grade. I also became a school counselor assistant, K1 teacher, and did research at the University of Oregon, where I also became an Oregon State Department of Education consultant after earning my PhD in school psychology. I was a university professor at San Diego State, and now I am a school psychologist.